We've all heard the acronym HPV. It usually comes up in conversations about cervical cancer and then silence. People often only mention HPV as a cause of cervical cancer, but is there more to the story? Is it just a women's health issue, or should men be paying attention too? How is it really spread? Why is it so common if it is? And if there's a vaccine, why aren't more people talking about it? Today, we're pulling back the curtain on one of the most misunderstood viruses out there. We're not here to cause panic. We're here to ask the questions most people don't and untangle the facts behind HPV. Welcome to Untangle. I am Ahmad Nobere. Welcome back. Now we're delving into the program. As always, I'm here with an expert in the field to untangle this. We have Dr. Fatima Inusa Anga. She is an obstetrics and gynecology specialist at the Federal Medical Center. She also has a master's in international public health and is also the founder of Safe Mama. Welcome to the program, Doctor.
Thank you.
How are you doing today?
I'm fine.
It's good to have you.
Good to see you too.
All
and
right.
I'm happy to be here.
Thank you so much.
All right.
So let's start with breaking it down. We've had a conversation on cervical cancer already and spoken about the causes, HPV. What exactly is HPV and why is it so important for people to understand it?
Okay, HPV is an acronym actually for Human Papillomavirus. And just as the end name implies, is a virus, and it's like the major cause or the cause of cervical cancer. However, HPV can also cause other forms of cancer, such as oropharyngeal cancer. It can cause anal cancer, and even in men can cause penile cancer. And then also in women, it can cause a benign form of growth around the genital tract, which we call genital warts. So I think that's probably like a brief history about it. And then it's also classified. We can have the high risk type and the low risk type. So the high risk type is the one that is usually associated with the cancers, and the low risk type is associated with the benign growth.
I don't know if I can take you back a bit. The first cancer you mentioned, what is that?
Oropharyngeal. That's the cancer affects the mouth, going down to the pharynx, and then probably even the esophagus. Yeah.
All right, fair enough. So what about the method of transmission? How is it being spread?
Okay, HPV, basically the spread of HPV is what we call, the mechanism is by skin to skin contact. So skin to skin contact, basically what we call we mean, like if you talk about skin to skin contact, it can be, okay, maybe probably you touching my hand or, I touch a surface where, So, but basically the transmission has been seen to be through sexual intercourse. And then sexual intercourse, it can be in any form. It could be oral sex, and that's why I talked about oropharyngeal cancer. And then it could be anal sex or the normal straight sex, of course, through the vagina. And basically, that's it.
Okay. So what about the prevalence of HPV? There's a common thing that's been said about that majority of people have it and all of that. Is there any truth to that?
Well, for the prevalence of HPV, generally, as research has established, the prevalence worldwide, we'll say it's about maybe 60 to 70%, like in the whole picture. However, it depends. It can, because of the prevalence of cervical cancer now, we've also seen that the prevalence of HPV is also rising. Take, for example, like cervical cancer, we have like generally worldwide, we can have up to like about 600,000 new cases per year. And so if you have that amount, you can actually say HPV can be up to that level, since we are equating HPV with cervical cancer. And then when you cone it down locally to Nigeria, you have up to like about 14,000 new cases of cervical cancer in Nigeria annually. And then if you have up to that, then you can say up to that level we can have for HPV.
That's interesting. But what about the actual symptoms? How does the person know that they have contracted the virus, and what do they do after?
Okay, basically for HPV, it presents as it presents just like the disease it causes. So if it's causing cervical cancer in a woman, it will present with the symptoms of cervical cancer. And then if it's in the man, if it's causing penile cancer in the man, it presents with symptoms of penile cancer. So take for example the cervical cancer in the female, of course the most common symptom we see them presenting with is abnormal vaginal discharge, postcoital bleeding, and then even abnormal vaginal bleeding. Then if it gets so long, that's to say the chronic states, then the woman starts presenting with other features of cancer such as weight loss, such as features of anemia like dizziness, headache, and all. So now coming to the male, if it causes penile cancer in the male will start having abnormal urethral discharge. And then, of course, probably even sores around the genital tract. And then, of course, furthermore, you can even have weight loss and then difficulty passing urine and then some other obstructive symptoms.
And now that you've narrowed in on men, maybe we should talk about that. There is a belief that HPV is just something that affects women. So in this case, what role do men play? Because there's also a belief that the only thing that happens in men is that they are carriers. So they can infect women, but they don't really feel any effects of this.
Okay, so I think that myth should be debunked to some extent, because both men and women can contract the virus, and the virus can affect the both sexes. Either male or female. Just as I have said, it can cause penile cancer in men. And then also, there's nothing that stops them also from having the oropharyngeal cancer in men. And then, so basically, I can say, despite being like a reservoir for the virus to some extent, they can also contract disease and get infected subsequently.
So is there a cure for HPV?
Well, I wouldn't say there's a cure per se for HPV. It's a virus that can actually be managed, to some extent. If we're lucky, well, it can clear, because when talking about cervical cancer, let me use it again for example, because cervical cancer is like the cancer that is typically associated with HPV. Now, we tend to notice that women that contract human papillomavirus and then are able to have a very strong immune system or take even medications. There are some antiviral agents actually that can be used in managing human papillomavirus. One of it is probably something like acyclovir and all that. So if we tend to see that if the woman has a very strong immune system and then in collection with medication, within a period of 5 to 10 years, the virus can be shed off completely. And then she may not manifest with that disease. However, if the immune system is very weak and then she doesn't get the appropriate treatment, then the virus tends to persist and then it will now develop cervical cancer in the end. So if I'm to answer that question, I could actually say yes and no together. Yes.
All right. If I understand, is the relationship between HPV and the issues it causes similar to the way HIV can develop into AIDS, or is it different?
Yes, it's somewhat similar. It's somewhat similar, because the HPV, what it does is that when it gets into the system, to some extent, it tries to incorporate into the DNA of the human. And that is what HIV does also. And so that's why shedding it off is quite difficult, because if it incorporates into the DNA, then it's difficult actually to shed it out. And something like that is what happens to HIV. And that's the reason why the advocacy for prevention is more than the cure now.
I think that we'll head into that now, the issues of prevention. But before that, a question I'd like to ask on all the programs. In your experience so far, what would you say is one of the biggest misconceptions about HPV and what people think about it?
Well, I'd say the biggest misconception about HPV currently, I think it actually lies in the vaccine to me.
Okay.
Because a lot of people actually think that, we've been talking about HPV, and then you now come to tell me to take the vaccine. They actually think the vaccine does not only prevent the virus, but also causes infertility to some extent. So that's one of the biggest myths I think I've actually heard about, the virus and the vaccine together. And then what it does is that it prevents the individual from getting a disease. So that's it basically, and that's what HPV vaccine does.
All right, I think we'll go on a quick break now. When we return, we'll delve into the issues of prevention and speak more about what the vaccines are all about. Don't go anywhere, we'll be right back.
Culture connects us beyond borders. It's a bridge between traditions, creativity, and the future.
Culture is alive, shaping identities and communities every day.
Art tells stories of resilience and vision.
Artists blend tradition with innovation.
Cultural preservation creates sustainability and empowerment.
Culture evolves and adapts.
Music and dance unites communities through movement.
And right here, in the heart of our cities, artists and creators are keeping these cultures alive.
On Culture Cove, let's explore,
celebrate, and preserve the arts and culture that define us. Welcome back. This is still Untangle, and we are breaking down HPV, Human Papillomavirus. All right, Dr. Fatima, let's talk about the vaccines now.
Okay.
First of all, let's start with who can take it.
Okay, both male and females can take the vaccine, and then boys and girls, starting from the age of 9 years, moving upward. There's a caveat to the age. In most cases, the vaccine actually has been built for those within the age range of 9 to 26 years. However, those that are above 26 years can also have the vaccine if it's recommended by their doctors. So that age range from 9 years is it was advocated for because of the difference in onset of sexual debris within children that are coming up. In some population, you find some children at the age of 10 years, they're already exposed to sexual intercourse. And some probably more than that. And even some that are quite unfortunate, probably by abuse or something less than that. So the vaccine is targeted at that age group so that they can get the vaccine at that point. And even if there's any form of sexual exposure, it tends to protect them before they become adults.
That was actually something I wanted to clarify if it's a misconception.
Okay.
That when people say that the reason this vaccine is for this age is because there are different ways it's put, but basically the implication is that women who are not sexually active, it's better for them to take it. Is there any truth to that?
Well, I wouldn't really say there's a truth to that. The main reason for getting the vaccine early is because of the difference in assumption, or will I say beginning of sexual debris amongst them. What do you call it?
Sexual what?
sexual intercourse,
Okay,
just
okay.
sexual DV, yes, amongst children in different locality, different ethnic group. It can be 15 years in Nigeria. You can go to another place and then you find a child of 10 years, 11 years already having sexual intercourse. That's it basically. So that's the main reason why that vaccine is given at that age.
Okay, I think naturally the question for maybe some people who are watching or women who are watching could be that what if you are outside that age, or even if you are within that age and for some reason somehow you've already been exposed to sexual intercourse and all of that. Does it mean they can't take the vaccine, or
they can actually take the vaccine, but then it's recommended when after screening and then you are found to be HPV negative, then the vaccine can be given to you. Yes, but before that age is usually between the age range of 9 to 26 years.
So what does screening entail?
Okay, screening actually entails, it's like a group of investigations, I would say, because cervical screening would entail HPV screening. It can also entail pap smear, and then also other screening modalities like visual inspection with iodine or acetic acid. Now, when you talk about HPV screening, what the lab scientist or the physician or the medical professional is trying to do is just to get cells from the cervix and then make the cells to undergo a process, a biochemical process. Then you identify if the HPV DNA is inside the DNA, the DNA of the cervical cell. That's just what you do for HPV. While for pap smear, you pick the cells and then you identify if there's any pre-malignant lesion. That's to say pre-formation of any cervical cancer in any form around the cervix.
Okay.
So that's it basically.
Okay. So the question now will be, how often should women do this? And for men, what is the test for them? And then after this, just to bundle the questions together, what happens if something is found at that point? What's the next step?
Okay, generally, again, screening actually starts from the age of 21 years.
Okay.
Yes.
Not 9 and...
No, because of how invasive the screening is.
Okay.
Yes. So basically, it starts before by the age of 21 years, which in assumption by then, of course, the individual is already an adult. Basically, it's for females. Now, I'm talking about cervical cancer screening, okay, for females. So now, that screening, when it's done and then you find that everything is normal, you advise that she should screen every 3 years to ensure everything is normal. However, if you identify anything abnormal, then you have to refer her to the right professional in order to take care of whatever it is that you identify. For the men, they don't have cervix, so we don't do.
I mean, for HPV, I mean.
Yes, for HPV, what ideally we just do for them. Well, I classically don't think there's a particular screening for men for now, except if, okay, we could say there is probably a blood form of blood screening where they could take the serum and then identify if there will be any form of HPV DNA. Also, because there are some of those screening that is coming up recently.
All right. So people who have tested positive, if that's the correct phrase about it, what happens next for them?
Okay, if you test positive, what we do is that right now you do a HPV DNA test, you test positive. The next thing is for the women, we try to subject them to undergo more of a colposcopy. Now that colposcopy is more of a more senior or intense form of screening, screening and then also diagnosis to help you to identify if, okay, this woman that has this human papillomavirus already, is there any change that has begun in the cervix that would actually tell you that, okay, cervical cancer has set in and then you should take action immediately. That's what we do for them generally. And then if we don't find that, then we can actually give them some antiviral agents, just like how I talked about initially, and then watch them closely. Watching them closely means that their own screening is going to be within a year or less than a year. And then you keep watching until you are sure that the virus has either shed off completely or the woman is not at risk of getting the cervical cancer.
Is there a phase where it can be too late?
Well, the only phase where it can be too late is when the woman has the full-blown disease and it has reached probably the end stage, which is what we call stage 4. of the disease. That is where you say it's too late. However, if you're able to catch it at the early stage, like stage 1, there's the chances of, in fact, beyond 5 years survival of 90 to 99% once you're able to catch it early and you treat it.
Okay, fair enough. So there's a question we usually get when we, have health explainers like this. People want to know the reality of it. If they want to get a vaccine, where do they go? How much is the vaccine? Do they pay for the vaccines? And you spoke about the age limit.
Yes.
If perhaps you go through that screening and you are found not to have, would the doctor let you take the vaccine? What does that entail? The reality of it?
Okay. So for the vaccine, sometime last year, it was launched in Nigeria, I think October 2024. If I'm not mistaken. So it was launched with the intent of, putting the vaccine into the national immunization schedule and then also making it available in tertiary facilities and as well as primary healthcare center. So of course, as we speak now, of course, the process of implementing those things is quite gradual. And I think for some tertiary health facilities, like where I am, Federal Medical Center, we have it. The vaccine is there. You can go there and then you can have it. Although I think there's a token you pay for it, which I'm not very sure of the amount now, so I don't want to say anything I'm not sure of. Then also, I heard it also in some private facilities, they also have the vaccine. If you feel you're not so comfortable with doing it in the government facility, you can actually walk into the private facilities and then you can get it done.
But are there any dangers to? Because when you mention when you say private, I'm assuming in a situation where the government have to prioritize the people who need it the most. In a private firm, you are the one making demands. I want this vaccine.
Exactly.
So if it happens that perhaps you are 35 or you are 40 or you are older, what happens then? If you get the vaccine, is there a danger for you?
There may be no danger, especially, for those people within that age range, and especially for those who have started sexual activity. The most important thing is to carry out the HPV test and then be sure that the patient is negative or the woman is negative for HPV and or the man negative for HPV. Now, if you're sure that those group of persons are negative for HPV and then there's no contraindication to receiving the vaccine, the lady can go ahead and have it or the man.
And it will protect them the same way to protect a 16 to a 9-year-old.
Yes, the same way.
All right, fair enough. Now, speaking about the accessibility, there's some stigma around HPV. What do you say about the process in place to ensure that is reduced and it's seen? Because maybe again you clarify for me. There's a belief that HPV is for women who are promiscuous. People don't even know about men, so they assume that it is because of this. That is why you have this. Is that the case?
Okay. I know there are a lot of myths and disbelief, about and beliefs. About HPV, of course. So, but the main thing is that we cannot categorically say it is women who are promiscuous that have this disease, because earlier on we mentioned that men can actually transmit the disease. So it's possible that this woman or this young lady is in her house. She's the only person or the only sexual partner of the man. And then he is outside and he gets it from someone and then he can bring it to her. And so you see now this woman, she's the only person in the house. She's not promiscuous in quotes, and then she's seated and then she gets the virus. You understand? So we usually see the virus in people who begin sexual activity early. That's one. So because of the prolonged sexual exposure in most cases. Then also people who have multiple sexual partners, irrespective of whether you are a male or you are a female. As long as you have multiple sexual partners, the tendency of that person getting the virus is high. So those are the main group of people. Then people also, to some extent, those who practice, anal sex, oral sex, and all sorts of. So those ones also, we tend to see the virus amongst them.
So let's talk about, I think you've spoken about how sometimes you can cure it, early detection and all of that. But is there some sort of statistic for fatality? if HPV develops into any of these things, what are the chances of survival?
Okay, for particularly, let me use cervical cancer again as an example because of how the association is with it. Because those other cancers, the vaginal cancer, oropharyngeal, they are very rare. You rarely see them. It's just the cervical cancer and then probably the penile cancer, of course, in males that you see. So for the cervical cancer, I can say, especially if you get it early, if you are able to grasp it early, 5 years and beyond survival rate is up to like 90 to 99%. That's if you're able to catch the disease early and then you treat it. But if it becomes a full-blown disease where you are getting to stage 4, and all that, then the survival rate is very slim. I could say even less than 50% or less than 40%. So I think that's how I could actually classify and say that's the fatality for HPV.
Yeah, fair enough. So to round up now, what advice do you have for parents, children, people who are grown as well? There are instances where, there's so much, will I call it pressure, so much attention to get women or young girls to get the vaccine. Should more young boys be included, or is it something that men should be taking? What's your general advice to how we should walk around this to ensure that there's a gradual drop in and protection across board?
It's okay. So I think the general conception we would have is more awareness. We have to create more awareness because in as much as, we are talking about the virus, we are talking about getting the vaccine, people don't still believe that the virus is there, and they don't really believe that, okay, the vaccine should be taken. They just feel that it's some vaccine company from somewhere that just wants to get, profit and decided to say, okay, this is it. This is to rule out vaccine for us to take. And some even think that the vaccine is only for Africans, but it's not the case. This vaccine has long been on ground. And then it has been taken in fact, if you go to the UK, for most cases, they are school-aged boys and girls. Almost all of them are vaccinated for HPV. Yes, almost all of them. So I think what I would say is that the vaccine is relatively safe. Let me put it that way. If you are talking about side effects, maybe somebody will say, but maybe my sister's daughter took it and she had this. Most of the side effects, the most common side effects that we see around are that of nausea, fever, sometimes headache, and maybe chills. And those ones can actually be taken care of with paracetamol. Then maybe probably the site of the injection, you may just see some redness, and itch, which tends to go down, within a very brief period of time. Now, for the less common side effects that may be, in quotes, may look like, something that can kill or something, is the one where you have allergic reaction, because there are some people that naturally they react to vaccines. So you can have a full-blown allergic reaction where you see the individual having rashes all over, and all that. And that again is very rare. And once you see that, immediately you go back to the hospital. There are drugs in which you can be given, and then it will subside the reaction, and everything seems to be normal. So I think that is it. Then on the part of the government, of course, advocacy and then policy implementation. And of course, they should try to make these vaccines available and affordable to the community. I think that is it.
Fair enough. And I probably you can also help us with this. Because of the way you pointed out the side effects of vaccines, maybe you can also let people know, do regular drugs not also have side effects?
They do.
Even paracetamol, Fatima, even analgesics.
Yes, they do. Regular drugs also have that side effects. Yeah, they do.
All right, fair enough. So that's, people don't think, wow, all these things you mentioned. So just one last quick thing to clarify. Okay. When we speak about sexually transmitted infections, especially stuff like HIV, one of the advice from practitioners is safe sex. Is that the same for HPV, or
yes,
do things like condoms not work at all?
No, it's almost the same for HPV. Of course, the pattern we usually take is, of course, the first one being faithful to one partner, and then if you are not able to make use of condom, and all that. So condom, to some extent, it protects against HPV, but not completely. It cannot eliminate the virus completely. And so that's the reason why in most cases, the vaccine and then being faithful is actually what we advocate for more. Yes.
And perhaps abstinence.
Yes, something like that.
All right. Thank you so much, Dr.
Yes,
Fatima, for breaking it down. We have been talking about human papillomavirus, and we will end the matter here, and hopefully you've gotten enough knowledge to understand why it's important to know about it, ways to prevent against it, what to do to ensure that you do not contract it, or if you do, the next steps to take. That aside, we will be joining you once again to speak on one of the main, what I call it, results of HPV, which is cervical cancer. We'll shine a spotlight specifically on that disease and see how, it comes to, has issues in terms of public health and regular health of individuals. Thank you so much for joining us. Don't forget to join us for the next episode on cervical cancer. Bye for now. I am Amadine Obewe.